Good morning, Dr. Ida Connor from Pediatric Pod Concierge Pediatrics in Bel Air, Houston, Texas. So I wanted to come on board carrying on with my conversation about rashes. There is another rash and another presentation where you do definitely want to go see your pediatrician. So if your child presents with a sore throat, has a fever, and then breaks out on this rash, and the rash feels like a sandpaper, it's like these little bumps, and when you touch it, it's like this rough skin, that potentially could be the presentation of strep. Okay, a strep throat. And so for that, your child would need to get a swab of the throat to make sure that it is or is not strep. Because for strep, we definitely want to go ahead and treat with an antibiotic because it is a bacterial infection. So if your child ever presents with, a sore throat, it hurts when they swallow with or without fever and then breaks out in this rash that feels like a rough thing, definitely reach out to your pediatrician. And at least in our practice, 100% this warrants a throat swab. And again, we do a rapid swab in the office, which is nice because within 15 minutes, you should be able to know, yes, it's positive or negative and need an antibiotic. Again, if it is negative, we, often will examine and decide if this is something that I'm still thinking, for some reason, I think this might be a false negative. We still send it off for a culture. That patient may still be started on an antibiotic until I get the culture result back because the physical presentation sounds very much like a strep throat.